Welcome to the All-in-One Medicare Show, hosted by Charles Vasquez and Nick Basto. All-in-One Benefits Group provides you with the right resources for your business. Charles and Nick will help you get ready to sell clientele management and stay in the know with insurance plans, policies, and procedures. On to the show.
Hello, good morning. Which camera am I looking at? Right here? I think it's this one. It's that one. Okay, there we go. Good morning, guys. How you guys doing today?
How's everyone doing?
We are back, and excited to share some new things, in the Medicare world, things that you guys need to know about, and
Sure.
to keep you guys informed. So, to kind of recap on what we talked about last time, I don't know if you guys stayed tuned. We were on the Latin Hustle show last time. It is a Spanish show. So if you guys are interested in hearing us in Spanish, make sure you guys check out Karen, Latin Hustle, her Facebook. We go live every couple of weeks and start, giving out this information that we give out in English, but we give it out in Spanish. So make sure you guys are staying tuned to that as well.
It's very important for you guys to know that we're bilingual. So there's a lot of agents out there that only speak one language, but we speak two, and we're able to help out a large percentage of the community.
Exactly. So perfect. So thank you guys for hearing that. Today we're going to kind of get into a couple of things to help you stay informed. And what are some of the things that we're going to be talking about? We're going to be talking about Medicaid eligibility. As you know, the last 2 years during the pandemic, there hasn't been any renewal process. That's what the state of Florida did for us, people with the lower income, to maintain that status. And, we're going to be talking about that. We're also going to be talking about
Enrollment period.
Yes, the enrollment period, extension and things like that. Also, Medicare supplement plan increases. I'm sure a lot of you have a lot of questions about that. And anything else, Nicholas?
Just the new upcoming benefits with
True.
the PPOs
True.
and the HMOs.
True. Oh, and we're also going to be talking about why Medicare Advantage is the new Medicare option. We're going to be giving you guys a little bit of insight on that as well. A little trend that we've noticed the past 5 years. So we'll get into it. We'll get into it. What is a Medicaid redetermination? Well, basically, Medicaid redetermination is, like I mentioned to you. I know this COVID-19 pandemic has made it, pretty difficult for us, and those that are on Medicaid kept their status this year, starting April 30th, isn't it?
Correct. April 30th.
April 30th, they're going to be doing the first Medicaid renewal or redetermining your status. So they're going to be checking your income. And if you don't follow within, that 1,000 as an individual or 2,400 as a married person threshold, then, you guys aren't going to qualify for Medicaid. And you guys need to make sure that you guys are updating your documents and things like that. That's one of the other things.
This is actually huge news because they're estimating about 4 million South Floridians that will be losing their Medicaid. Through the COVID pandemic, many people qualified, but now they won't.
Yeah,
so it's our job as a team together to make sure that if you get a letter in the mail, or if you haven't got a letter and just want to check beforehand, to make sure that we put the right information in so that you don't lose your status.
Correct.
Now, if you do end up losing your Medicaid status, you definitely need to call us quick at 954-614-5488 because we need to reapply you immediately.
For sure.
And not only that, you will lose your coverage on your Medicare side too, because usually if you're on a Medicaid plan, you're usually on a Medicare and Medicaid plan with, either if it's Medicare Advantage or depending on the case of what your insurance is, you most likely will lose that too. So we got to reapply you in a plan to make sure you don't lose your coverage.
For sure. And to tag and to piggyback off of that, what's required for the redetermination process? Well, basically what's going to happen is you guys are going to be getting a letter in the mail, just basically stating, hey, Medicare beneficiary, it's time to renew your status. And what you're just going to simply do is send in the documents. Well, your question may be, how do I send these documents? Where do I send these documents? I'm just confused. You know what? That is the reason why we're giving out this information, is you get to have this resource with us, and for you guys to know that you can come to us for this. Don't get worried about it. You can count on us, like Nicholas said, 954-614-5488. Give us a call and we'll help you through that process. We'll let you know exactly what your card says and what documents are required just so you guys can maintain that status, which is very, very important. And
I just want to touch
yeah,
on one
sure.
thing. I know we're talking about people losing their Medicaid, but there's many people who still qualify for Medicaid. So we also help in that process. Even though we do mostly Medicare, we help out our clients who are low income or struggling to meet their needs. They might qualify for a Medicaid plan. So, and as we talked about before, we can touch on it again a little bit again. People who have Medicaid with Medicare, you won't pay for your Part B Medicare premium. Not only that, your benefits will be a lot higher, a lot stronger, a lot more coverage. So we would love to help you out with that process too. So
absolutely.
If you want to see if you qualify for Medicaid, call that number at 954-614-5488.
Exactly, and that's very, very important. I think you mentioned this recently that about what happens if you were to lose the Medicaid. Just want to make sure that I stress this to you guys. If you guys lose Medicaid, for those that have Medicaid, you will be dropped from your Medicare Advantage plan.
Yeah.
So all those benefits that you're receiving in dental, vision, your healthy food card, you will lose it. You will lose it if you do not update that status, right away. And like Nicholas said, it's going to be happening October 30th. So right now
April 30th.
April 30th. Excuse me. What am I saying? It's March 27th today. So there's not much time left. Make sure you guys are doing that.
Call us before it even happens. I think that's safer.
Sure, absolutely. And like I said, we are that resource. So make sure you guys are giving us a call to help you with that process. Okay, guys? Also, we're going to be talking about the extension, the open.
That's another huge news that we just received as agents, that Medicare CMS, which is Medicare and supplements, things like that of that nature, will be opening up the open enrollment period all the way till July, which is huge news. Many people think that they just have that first enrollment period, which ends January 1st, but now you have all the way till July. If you're not happy with your insurance right now, you can still switch, which is huge.
Exactly.
There's many people that are not happy with their plan because, let's say, a doctor's not in network, or they're tired of referrals, or they want more money back towards their Part B premium. You still have that option right now. So please call us at 954-614-5488, and we'll definitely requote you or figure out what's a better benefit for you and your needs.
Absolutely, guys. You guys have to make sure you're on top of that, because I know a lot of you guys are thinking about, is my policy the best policy? Well, if you have a doc that's not in network, if you have a medication that's not covered, have you hit the donut hole already? Guys, it is still time to have a second opinion and a second option. Think about it. If you guys are not happy, don't wait any longer. Like I said, the 31st of July is, some time away. So, take these next couple months to start really thinking about if what you have is the best option for you. Are you guys dealing with referrals and would like a plan that doesn't have referrals? Are you guys, having, like I said, a doctor in network? Is a medication not being covered? Is your medical center not providing you transportation? There's a lot of things that you guys need to consider regarding that Medicare option. So please take 2 seconds to think about it. If you feel like there is a change that you need to make, you know that we're here. 954-614-5488. Again, that's 954-614-5488. And also, if you guys want to stay informed on, the new products that are out there and things like that, you guys have to get on our social media platforms, our Instagram, All-in-One Benefits Group, and our Facebook as well. We are constantly, weekly giving out informational news to the community, letting them know what's available out there and what changes they are able to make and things like that.
One thing that I want to mention that is very important, that I know a lot of people like to do, sales on the phone and things like that, but we want to make it clear to you guys that we're very close with the community and we're very accessible. So we'll even drive to your guys' houses or meet at a location that's good for you, that we can sit down, go over the plans that, best fit your needs. A lot of times people are calling and it's not comfortable over the phone giving you information. So we want to make it clear to you guys that both Palm Beach, Broward, and Dade, we will be able to go to your houses. And not only that, if you're okay with the phone, we can do that even all of Florida, even to Georgia and North Carolina, we're
Absolutely.
still
Absolutely.
accessible. So
We're in plenty of other different states, so make sure you guys are taking the opportunity and getting to know your broker. It's very important, and that's the service that we're offering you guys, is that we will meet you on a personal level, and not just meet you, get to know you, on a personal level, know, things that you will need to do better for your plan. What are things that you need help with? What are things that you do well that you could do better, and things like that. So it's make sure you guys are having an agent that's constantly there for you, giving you information current up to the current date. I think it's time for a commercial break, and we'll take a commercial break here and get back to you guys and let you guys know why people are choosing Medicare more oftenly, and a couple of other good news for you guys.
remember, if you have any questions, call us at 954-614-5488. Thank you.
All righty, guys. We'll be right back.
Are you compromising your medical care for doctors out of your network? Are you tired of dealing with referrals to see a specialist? Are you aware that you can save up to $155 a month on your Medicare premiums? You need an all-in-one benefits company that can help with all of your Medicare plan needs. Call today, All-in-One Benefits Group at 954-614-5488. We're here to find an all-in-one plan for you. 954-614-5488. Call today for open enrollment.
You've been watching the All-in-One Medicare Show with your hosts, Charles and Nick. If you'd like to get into contact with All-in-One Benefits Group, contact 954-614-5488. Now back to the show.
We're back. Hey guys, we are back. This is Medicare All-in-One Show, and we're going to be kind of giving you guys an update on some extra stuff. We've noticed a pretty big trend in the market lately. Previously, Medicare had a bad stigma, Medicare Advantage more specifically, and what was the stigma? I guess the stigma is the HMO. A lot of people do not like the HMOs. They don't want to deal with a network, they don't want to deal with referrals, and they just want to have an easier going plan that will allow them to go to whoever they like and even get a second opinion without, a doctor telling you, oh, don't do this or don't do that. But there are options that we can do. And here we're going to be talking about some of those things on why Medicare Advantage is more popular. The added benefit of an all-in-one plan, and that's number one. A lot of people want to get the vision, the dental that have Medicare supplements. Some of you guys have a Plan G. Some of you guys have Plan N. Some of you guys have Plan F. And I know that you guys have to buy your dental and your vision coverage separately, including your prescription drug coverage. So the number one thing why people choose Medicare Advantage is because at a zero extra cost, you guys are able to get all these benefits. You guys are able to get your dental benefits, your vision benefits, and all the things that you need. At zero cost, you're not paying a dime. So that's, the number one thing about why people are choosing Medicare Advantage is the fact that you can get everything under the same umbrella, which is really, really important.
Not only that, they're giving food cards, they're giving
Absolutely.
flex cards of up to $2,500 that
Absolutely.
many of you qualify for.
Absolutely.
So these are benefits that are rich, that many people don't even know that they're out there. So
Exactly.
if you're interested in that, please reach out to us, because those are benefits you can get right in your pocket at free of cost.
Absolutely, and that's a great point, what Nick brought up, because that is what's needed right now in the community. And let's think about it like this. Those of you that are suffering from any underlying conditions, like maybe end-stage renal disease, or having some conditions where you aren't able to switch your plan because you have to go through underwriting, and we know how underwriting is. You have to ask 30 questions about your health. I need to know your medications and things like that. And if the plan just says, hey, you're too sick for us to accept you into our plan, they're not going to accept you. So that is the reason why Medicare Advantage is another great option for you guys, is because it gives you the ability to pay lower for your Medicare.
And they can't deny you.
And they cannot deny you, which is the most important thing. So guys, if you guys are thinking about, hey, my Medicare supplement is a little bit too expensive for me. Unfortunately, my health doesn't allow me to get a cheaper rate. Well, you have this Medicare Advantage option, and you can choose a PPO option too, where you don't need to deal with referrals and things like that, which is amazing.
I'm
See
happy
whatever
you
does
brought
it.
up the PPO because, like they say in the Medicare Advantage world, there's a stigma and people are scared of it. But with the PPO, you can go out of network, and there's no premium.
Yeah,
we know
exactly.
with Med Sups, you do have to pay a premium, but with the PPO or the Medicare Advantage, there is no premium. So if you're afraid that you can't see a doctor out of network with a Medicare Advantage plan, and you're wrong. You can.
Yeah, absolutely.
You can absolutely see a doctor with an out of network
Absolutely,
provider.
and you can just make sure you know, no referrals with these PPO options.
Yeah.
Okay, you're saving $150 on your Plan N or Plan G premium, and then at the same time, you know, you don't need a referral still. So it's you're getting the best of both worlds, and it's only costing you your Part B premium. So guys, make sure you give us a call, letting us know 954-614-5488. Fred, you got a question?
I do. I got a question. Hey, One. So if I sign with your organization, with you guys, I get the free consultation, and then I decide to go forward, and I'm on the plan, and the plan just ain't right. Whatever we came up with is not working for me or my spouse or my kids, whatever the deal is. It's just not right. Now, you're working with me continuously during the process?
Absolutely, absolutely.
Yes, of course. Like we tell all our clients, when we enroll them in a plan, we hope it works out, obviously, but if it doesn't, we always tell them, hey, it's not the end of the world. You'll still have an opportunity to switch again because of the new enrollment that came out, like we talked on the previous show, that goes all the way till July, which is huge news for you guys. Remember this. You have till July now. So this is huge. Many people aren't happy with their plan, and like Fred asked, if you're not happy with your plan, you can still switch all the way up to July.
Which is huge, and that's one thing that we want to make sure that you guys understand. Freddie brought up a great question: is the continuous customer service and the continuous attention that you guys need, you know, making these options. I see it this way, and maybe you guys can understand if you guys are business owners. You know, when you hire, you know, employees, I'm sure, you know, you have to find somebody that is the right fit for you. Not everybody works the same. Everybody has a different workflow. So, you know, if an option is not fit for you, you guys have the ability to change at zero cost. So that's why we offer this free consultation, not only to obviously keep switching you, because that's not the point of this, but to find the best option for you. You know, and sometimes the only way to find out if something is good for you or if it's not good for you is just trying it out, you know, and we all go through that. You know, we try a whole bunch of different shoes for us to really realize what is a shoe that we like. So that's just how we see it as well. If you guys try something out, you know, continue to find the option that is for you.
Important information too is that when you do end up switching, whatever day of the month you switch, you'll be effective the next month. Some people are confused about that. You can switch at any time of the month, but you'll be effective the previous month, the first day of that month.
That's correct.
So you won't lose any coverage. You'll be covered, you know, the first day of that next month. So there's nothing to be worried about.
Perfect, exactly, and I'm with you there. The second point I wanted to bring up on why Medicare Advantage is becoming the more popular option in Florida, and I know we mentioned the cost savings, but I can't stress enough the cost savings about Medicare Advantage. And not only Medicare Advantage, we're even talking about Medicare supplements as well. You know, so if you guys have high premiums and things like that, make sure you guys are contacting us to find, you know, the lowest premium possible. But the cost savings part about Medicare Advantage is the prescription drug part. You know, you don't have to pay an extra premium for your meds. If you have a Medicare supplement, you know what we're talking about.
And no deductible.
And no deductible as well. And that's one thing about Medicare Advantage that, and I'm glad you brought that up, Nicholas, is super, super important. You guys that have your Plan Gs, your Plan Ns, you guys have to hit, you know, a $230-something deductible before the plan even covers. Medicare Advantage, the cover starts right away.
Yes,
you go to your primary first day of the year, it's $0. So there's
And
no
specialists.
and specialists. So, you know, that's huge. No deductibles, man. I mean, I wish every single plan that we sell could be like that, but Medicare Advantage is that way, and that is the reason why Medicare Advantage is becoming more popular, is because of how rich the benefits are and everything, you know, into that one policy. So,
and just the different avenues. Like
Absolutely.
you have the HMO, you have the PPO, and then you also have a give back plan.
absolutely.
We touched on this in the past, but just real quick, if you're not seeing a lot of doctors and you have your Medicare and you're tired of paying so much money every month, there's give back plans that can pay up to back your full Part B premium.
For sure.
So you can pay up to $5, $10, or
man.
$0 every month for your Medicare, which is huge.
Yeah, I'll give you an example. The other day I had a client. He had a plan, was a Plan N supplement. He was paying $164 for his Medicare, paying another $150 for his Plan N. He was paying $300 every single month for his Medicare. And guess what? So was his wife. They were paying together $600 together as a family for Medicare. You know what me and Nicholas did? We got him off of that supplement, put him on a Medicare Advantage plan, and because they were so healthy, we gave them the Give Back plan. The Give Back plan is what helps you pay for the Part B premium. That family that was paying $600 is now paying $0 a month for their Medicare. So talk about a savings right there.
That's huge.
So make sure you guys are thinking about these options. Don't be afraid of the HMOs and the PPOs. Nowadays, the networks are so big. All the doctors, all the hospitals are participating with the plan. You can find anything you want. So make sure you guys are contacting us and just get information. 954-614-5488. Just find out. You know, there's no obligations with us. That's why we have this free consultation, so you guys can get information. And if the information is good for you, then take it and run with it. If it's not good, we go on our own ways and continue to help other people that need the help.
Another option, like we talked about, are the Med Sups, the Medicare supplement plans. These plans are more costly. You do have deductibles and a premium, but you will be covered at 100%. We do sell these policies for people that have more income. So if you have any questions on those, we would love to help out on that process. And not only that, the ones that are already on the Medicare supplement plans, you guys know the premiums go up every single year. And that can be costly, and with everything that's going on today, you know, you want to save as much money as possible. We can reapply you to a Medicare supplement plan to see if you can save on the premium side. So that's some huge news that we wanted to talk about too.
Absolutely, absolutely. So what Nicholas is talking about here is, like, if you guys have a Plan N, or if you have a Plan G or a Plan F, and you want to stick with those plans because you like the coverage, just simply give us a call and see what better rates we can give you. A lot of the times people, you know, come to us and say, hey, you know, Nicholas, hey, Charles, you know, I'm paying a whole bunch for my Medicare supplement. You know, every year goes up, and, you know, 6 to 8%. And, you know, imagine 6 to 8% your premium increasing. Like I said, just give us a call. We have a whole bunch of different insurance companies, carriers, that will be able to give you that same exact coverage. No change, just at a cheaper rate. So make sure you guys are calling us to get that cheaper rate. 954-614-5488. Again, that's 954-614-5488. Get that cheaper rate. Check your Medicare coverage, just so we can help you out the best that we can. I think we've covered, you know, everything that we needed to cover today. We're gonna, you know, stay tuned. Obviously, next week we're gonna be talking about some other good stuffs about Medicare and Medicare supplements. So stay tuned. And if you guys have any questions, you guys know where to contact us. Again, that's 954-614-5488. Contact us in our platforms. And you have a question?
Yes.
Ready?
I got a question. If you see, you're hearing this program and you hear, but you're not 65 yet, but you know somebody who is, maybe you pass this information to them so that they can call you and say, you know what, because the consultation is free, correct?
That's correct.
So there's no harm, no foul if you give this information to somebody else who they can get in touch with, because you're looking out for your friends and people that you know that are hitting this number.
That's correct. That's correct.
Thank you for bringing that up. That's actually huge, because there's a lot of people that we talk with that they end up not qualifying, but they end up telling us, hey, you know, my mom or my sister has it. I would love for you to help her out. So that's actually really important that you guys do know that. There's many times that maybe you won't qualify, but you can actually help a family member out or a friend that's actually in need, you know. So, and we're willing to help anyone who it is. And like Freddie said, free consultation. Whether we sign you up or not, we don't charge nothing.
Absolutely, absolutely. So you guys just make sure you guys, if you have any family members, any cousins, any relatives that is over the ages of 65, and you hear anything regarding, you know, concerns about their plans, or maybe you take care of their plans, maybe you handle, maybe you're the son and daughters of these Medicare beneficiaries and would like to know if you guys can have a savings for your parents. That applies to you as well. So make sure you guys are contacting us, asking us the right questions that, you know, we can further help you to the best of our abilities. All right, so we have a question?
And there are people, right now I'm in a situation where people are moving into 55 plus communities, and they can't afford to pay even the HOAs that are small, $500-600. I mean, the $600 that you just mentioned, I know somebody who did not move into a great 55-plus community because it was short almost $700. If it was done with this medical plan, you got them down to zero, they qualify. It changes their whole life.
Oh yeah, I mean $600. $600 times 12. We're talking about a great savings right there. That's 70 something, $7,000 something dollars. It's in savings there. So that's great. So
we're always interested. We're more interested in your needs than any type of sale or anything. We want to find ways to help you, whether it's saving costs, finding doctors, making sure you don't hit the donut hole. I mean, whatever it is, we're here to find out what is your issues and then fix them. I mean, just that story you talked about with the $600, that's huge.
Yeah,
you hear about this more often than not, but there's people that don't understand that you can actually save a ton of money on your Medicare or Medicare supplement plans if we requote you, or just find different ways to find to help out with your needs.
Yeah, and that example that I gave, that's the max savings. That doesn't even have to happen to you guys. We're not looking for that max savings. We're just looking for help. And you guys know. You guys know if you're in need. You guys know. If you need more money a month on savings and things like that. So we're just here to help and giving out information. If this sounds like you and it sounds like that you need help with your plan, just make sure, do not hesitate to call us. The longer you wait, the more you're going to be paying on your premium. So that's just the reality of it. So just give us a call, 954-614-5488. And I appreciate you guys for staying tuned and let you know about this information.
And come back, because we have a lot of information coming back.
Absolutely.
Soon, so.
We got some great events coming out in the future. We're going to be giving out food to the community and things like that. We're scheduling the dates and the times, and so just stay tuned, pay attention, and we're going to be inviting you guys to some pretty good stuff.
And once again, if you have any questions, call 954-614-5488. Thank you.
Guys, thank you.
Thanks for watching the All-in-One Medicare Show. Tune in each week to learn about the best Medicare group to help with your Medicare plan needs. If you have any questions or would like to be on the show, call 954-614-5488 or go to allinOnebenefits.com. Let's resolve it all in one.